Thank you very much, and very welcome to everybody who's joining us here today. First and foremost, I'd like to heartily thank my sponsor, HDB, for making this wonderful opportunity possible. So this is the backdrop and the inspiration to my study. The story of livestock farming is one, of course, of many challenges, but there's also opportunity and ambition in there. In terms of ambition, it's really for a healthy sector that's resilient and sustainable into the future. We're hearing more and more about productivity and profitability, but to me, that means reducing losses and tackling disease, bringing down things such as mortality on farm. Increasingly, consumers and government want more transparency about our standards, and this will have implications for trade, both at home and abroad. And in the future, as public money supports livestock farming, that sets up a social expectation around standards on farm and understanding more about how we use medicines. So the bottom line is we need to be ready to recognize, apply, and demonstrate best practice. So how do we do this? We'll consider the questions that drove my study. What factors do you think might influence and support best practice? Can you think of strategies that would unlock opportunities? And what do you think about the future of animal medicines in the UK? Well, this is where I went to find some of those answers. I traveled throughout Europe last year, and I wanted to visit those higher production countries that had similar challenges, but perhaps diverse solutions. And for that reason, I visited Ireland, Denmark, the Netherlands, Belgium, and Germany. But I also wanted to visit Scandinavian countries that had a real history of leadership in this area and a prevention is better than cure approach. And for that reason, I visited Norway, Sweden, and Denmark. In New Zealand, of course, they're world famous for trading on the export market with a high quality good. And I wanted to understand how they balance this with responsibilities around anthelmintic resistance, AMR, and also animal welfare. At the same time, I also wanted to explore opportunities for future regulatory collaboration between the UK regulator and the New Zealand regulator for the authorizations of medicines. So the very first thing to say is that no one country I visited got everything right, but collectively, like the pieces of a puzzle, it formed a picture of what was possible. A key message that I got loud and clear was that if you focus on animal health and welfare, this naturally drove better medicines use. And within that guiding principle, there were a number of key influencing factors that positively benefited best practice. And these were animal health partnerships, those that care for livestock, the useful use of data, and good biosecurity. So if we look at each of these in turn, firstly, a great example of an animal health partnership is Animal Health Ireland. They've been working on endemic disease for the last 10 years. And I spoke with the chief executive about leadership skills and what were the key success factors. It was very important that there was a clear vision from the outset, some strong industry leadership and stakeholder buy-in. But one of the key elements of a program in terms of benefits was their coordination ability. And they've worked with a memorandum of understanding with Teagasc State Agency with a rural advisory network to further disseminate best practice and collectively working towards improving animal health in Ireland. So they've reduced endemic disease, which is fantastic, but also as an indirect effect, they've driven animal medicine's best practice through the use of vaccines in their endemic disease control programs, and also just by reducing the burden of disease, you use antibiotics more responsibly. So farmers and vets have a responsibility in terms of the care of livestock. This is an example of one dairy farm I visited in northern Germany. It's a 550 cow unit, and the philosophy on that farm was really one of taking the initiative, monitoring and paying very close attention to detail and getting ahead of issues as soon as possible. I had an opportunity as well to visit the New Zealand Veterinary Association and to hear about how they're making improvements in medicine stewardship and really taking an approach that looks at the role of the vet and the full life cycle of the medicine. In the Netherlands and in Belgium, I got to spend time with cattle and pig vets and to really spend time with them as they were visiting their clients. And I could see that they had a really diversified role. They often administered vaccines and they gave advice on housing and ventilation and nutrition. these were really elements that were really valued by farmers. They saw them as trusted advisors and really good problem solvers. So data and how to make the best use of it was a theme that came up time and again. And I had an opportunity to visit Fernanda Doria at the Swedish Veterinary Institute to learn about her work. She's really keen to make data more useful, both for farmers at the farm level, but also for vets and at the national level. And she's developing a framework where you can see from this scheme, she really understands the concerns of farmers around sharing data. And she suggested a model here that allows analysis at source and sharing of summary statistics. And indeed, the ideal system might collect all sorts of production data, animal health and welfare metrics, and treatment outcome, along with external sources of data to provide really valuable, actionable data back to the farm so that farmer and vet can make better decisions. And it's worth thinking as we're developing new IT systems in the UK, are these providing what farmers need on farm? And are they also at the national level providing some opportunity around trade? So good, effective implementation of biosecurity is a real challenge. But what I learned from speaking with vets in the Netherlands and in Belgium was that you need to actually make it specific to farms and create new social norms. And a very practical example of this was dairy vets that I spent time with, never bringing their own clothing and boots onto farm and using what was available. And as they crossed over the threshold and used farm clothing, it was a visual reminder of the risks of disease introduction on farm. Speaking with researchers at the University of Ghent, I learned more about their assessment and advisory tool, Biocheck. And I could see real value in this. It was developed initially for both the poultry and the pig sector, but it's now available for the cattle sector because it looks at the risks specific to that farm and gives some bespoke advice. And we know that biosecurity and the good implementation of it can drive best practice. And it's a really important element because if you reduce endemic disease, you're going to use medicines more responsibly, such as antibiotics, but also incorporate vaccines into control programs. So all of the measures I spoke about cover any medicine you care to mention. But I also look specifically at some key areas on farm in terms of medicines. And they were the antibiotics, vaccines, parasite control, and pain management. And we've had a fantastic talk by Duncan just now. And indeed, the UK has made huge progress over the last number of years, largely on a voluntary approach. And so the next step is to look at long-term sustainable use and how we build on the progress of the voluntary approach. And in doing this, we might consider some other appropriate regulatory mechanisms. And I've put forward some recommendations here, and you can read more of them in my report when it's published. But to give you a flavor of some of the ideas that I came up with as I was talking to people that develop policy across the globe, you can have more of a focus on benchmarking for vets and farmers, establishing a one-to-one relationship, offering not only training, but also facilitated farmer-led support. We could do more with data around treatment outcomes. And at the end of the day, it'll be important to leverage this progress for trade opportunity for UK farmers. There is huge improvements and potential in terms of opportunity with vaccination, particularly in the ruminant sector. We know uptake is very variable, and we can do more in terms of storage and administration. Vets in Belgium and the Netherlands frequently administered vaccines, and that service was really valued by farmers. So I think in the UK, farmers could be offered more help in terms of helping to implement best practice with vaccination and getting more from their investment. And to do this, we can think about national control programs or potential government support around herd health planning and also biosecurity. But at the end of the day, as we're implementing these measures, it's worth considering something that came back time and again that I heard. And that was that vaccination does not replace good management routines, but good management is really needed to get the most from vaccination. So I visited Mike and Liz McGreary. They work and own Kumenga Farm on New Zealand's North Island. It's a finishing farm with almost 30,000 sheep, and they've been involved with a parasite control resistance project, tackling some of the issues on their farm. They're leveraging the breeder-finisher relationship to share knowledge and information through the supply chain and to really take a landscape level approach to parasite control. And I knew they were really getting to grips with the issue when I heard Mike say to the other farmers that were there on the day, we're farming the worms as well as the sheep. And they realized it wasn't just about the drenches, but overall management on farm was key. And finally, in terms of best practice with pain management, every country I visited was at a different place in terms of progress on this. And it was linked to various things in particular countries. For example, in Norway, it was strongly linked to animal welfare. In Denmark, more so to productivity, and in the Netherlands to the responsible antibiotic use. If we in the UK are to stand amongst the best of them in the world and to really support and provide evidence that we have some of those highest welfare standards, then what we need to do is ensure we provide best practice in pain management for all painful procedures and illness on farm. And finally, what does the future hold for animal medicines? Well, the 1st of January next year, it will all change. The UK, aside and separate from the EU, will be a different country in the sense that it will be a smaller market. And there's potential risks there in terms of the attractiveness of it as a market and the availability of medicines in the medium to longer term. But there's also an opportunity for government to renew legislation and to think about global cooperation. So I took the opportunity to speak with the regulator in the UK, the VMD, and also the regulator in New Zealand to see what plans they had in place in terms of collaboration. And I was heartened to see that they were both on the same page and wanted to see a path to developing some really good cooperative actions. And what I could see was that taking this international collaborative approach and basing it on science means you can really help safeguard the UK as a #1 spot for development of innovative solutions and the availability of medicines. But importantly within this, farmers will want to see policy that supports trade opportunity. And so to sum up, if you want to drive animal medicine's best practice, then let's start by focusing on animal health and welfare. And to do that, we need a strategy and vision that spans the 4 nations. Livestock farming, in terms of being resilient and sustainable into the future, should recognize, apply, and demonstrate best practice where it can. I talked about various influencing factors, but to harness them and get the most of them, we need to build an animal health and welfare ecosystem that really captures those elements. And finally, the future of animal medicines should be built on collaborative international collaboration and an evidence-based approach. Finally, I'd like to say thank you very much once again to my sponsor, HDB, to the 2019 cohort. They're an absolutely brilliant group of people, to everybody at the Nuffield Farming Scholarship Trust office, and to my editor, and importantly to my employer, NOAA, who have supported me throughout this journey, and in particular to the Chief Executive, Dawn Howard, and finally to my family and friends, and particularly my husband, Danny. And thank you for listening today.